Well, welcome everyone to the general and keynote session here at the 2020 Small Urban Network, or SUN conference. We are really delighted to have the guests that we have joining us today for this discussion, and it's really timely. You know, there's so much has changed, and our partners at the Federal Transit Administration were tasked with a massive undertaking when it comes to the CARES Act and the implementation, and having to, in a week, get a whole set of apportionments out and do guidance through a series of FAQs and discussions. And, you know, the partnership between you folks who are out there making the trips happen and our partners at the federal agency, the Federal Transit Administration, have really never been more critical than they are right now. And you know, we're all reticent that we're not in Missoula for an in-person meeting. And I know traditionally at our SUN conference, we've tended to have the regional administrator. So Cindy, I know we talked yesterday, we'll see you from Region 8 in Missoula next August, when we actually, all things knock on wood, we will be there. But doing it virtually really allows us, in this case, to have three of the key leaders at FTA that we would not be able to bring together because they're too valuable here in DC, and it's tough to get ever a chance to have the three folks we have here all in one room. We do benefit from that with a virtual conference, and I'll introduce the three of them. We're going to allow the presentation to go on, and at the conclusion of that, I'd ask all the participants, please put your questions in the chat box, and I will ask them directly of our participants. And those participants are Matt Welbes, who is the Executive Director at the Federal Transit Administration. Matt directs the daily operations of FTA with an emphasis on leadership, policies, budget, strategic priorities. Matt has spoken at our expos and is somebody that many of you have no doubt come across in your work, and we're really grateful to have his participation. And Matt said, well, I'd like to get a couple of my colleagues to join in to help with the Q&A, and then, you know, the two colleagues who are going to be helping out are more than adequate helper-outers. Enrique Buchanan is the FTA Associate Administrator and Chief Safety Officer from the Office of Safety and Oversight. She previously served as the Associate Administrator for Program Management. And one thing that you can kind of dig out of Enrique's bio when you find that online is she did a lot of work around the stimulus funds and the ARA funds. And I'm sure that expertise and that kind of experience has come to fruition and been of good use as we've done with the CARES Act thing. So this kind of isn't her first set of emergency appropriations coming into transit, which has clearly been helpful. And last but certainly not least, Bruce Robinson, who is the current Associate Administrator for the Office of Program Management. He was the deputy in that administration since 2012, and he also oversees the Office of All Transit Programs. So first and foremost, thank you, Matt, Enrique, and Bruce, for joining us. And what I'd like to do is kind of turn it over to you, Matt, to take the con and do the session, and then we'll get into the Q&As. So much appreciate the three of you giving us some of your valuable time today.
Thank you very much, Scott. And I am really glad to join the virtual SUN conference today. I should tell you all, I'm in Philadelphia. I'm moving my daughter into a college apartment. There's people right outside the door vacuuming. There's activity. So who knows what will happen while we're on the call. But last night, as I was preparing, I said, well, you know, I'm going to go check out CTA's Twitter feed, because, you know, you do a really great job of posting things. And I ran across Chris Eilinger's, you know, he had taken a bunch of NTD data and told some stories about, you know, what's happening with small urban transit. So that engaged me and kept me up a little later, but I was excited to see what he had put together. So thanks for doing that, Chris. And Scott, I want to thank you for inviting all of us today. Folks, you should know we've worked together for many years, and on a regular basis, one of the things I like to do is play hooky from work, and on my way into the office, I'll get off a few stops early, and I stop by CTA's headquarters, and Scott and I will get together for coffee, and we'll talk about our kids in college and public transportation, whatever else is going on. I think that Scott's really clear thinking about what we're all trying to do and his clear communication have been just very valuable to all of us. And while the coffee is virtual right now, our continued conversations have never been more important. I think we all know that. So on behalf of our acting administrator, Jane Williams, I'm happy to be here. And later this month, she'll have been with FTA for 3 years, leading our agency. And she's really been a great advocate for rural, specialized, and small urban transit providers. It's been a real pleasure to work with her in that space. And I know she looks forward to joining many of you next week for an FTA update for all CTA members. And so as Scott noted, I've got Enrique Buchanan, our Associate Administrator for Safety and Oversight, and Bruce Robinson, our Associate Administrator for Program Management. And as Scott noted, they've been involved in the lines of work we're going to talk about today. Enrique right now is leading our overall COVID-19 response effort, and Bruce has coordinated our delivery of the $25 billion in the CARES Act funding, along with our 10 regional administrators. And so we have the regional administrators joining this conversation today as long. They're attending the session. So, our people at FTA, they do have a wealth of knowledge about how our federal program works. And what I want you to know is that during 2020, Bruce, Enrique, the regional administrators, and everybody in our 500-person organization has really been examining every program flexibility we have to support you as you're delivering your public transportation program. We are in the middle of what's officially called the COVID-19 public health emergency. That's a phrase we use at FTA frequently. And, it's a public health emergency, and it's affecting our physical health, our economic health, our mental health. There's a lot of stories about that right now, as well as all aspects of our communities, including people sharing rides, taking public transportation. And so it's a real, I think, moment of truth for all of us. And so, if we've ever asked, how will I act when there's a historic crisis or a moment of profound change upon us? Well, here we are. And, we've all observed in recent months how our roles as transit leaders have really been strained by some of the challenges with changes in ridership, changes in revenue streams, but also how the actions that are and the services that we support and that you provide are more important than ever. So my simple personal example is that my mom, she moved into an assisted living facility back at the end of February, and what timing that was. She had lived independently up till then. She decided she needed a little more assistance a few days a week, and so she moved into a place in Richfield, Minnesota for her independent living. And for the last 4 months, nobody in the family could come see her. And I'm pleased that that was the setup. That was the right thing for the facility to do. Just 2 weeks ago, my sister Marie, she's now the designated person who can go visit. But during that time, my mom did need assistance. And the woman, her name's Anita, who comes to see my mom a few times a week, she was taking the number 21 bus to see my mom. And because public transit was there, and it was operating safely and providing that essential service, I could sleep better. And I know that's the case for millions of other people who knew that their loved ones could get what they needed because of the service people have been providing right now very carefully. So I just want to thank you all for persevering and doing the work you're doing during 2020. I'm just going to tell you briefly about the status of our CARES Act funding, about our overall COVID-19 related support, the status of some of our ongoing programs, and then we really want time for a discussion with all of you. That's really what we're here for. I know you've been following the congressional deliberations. You had a session about that just before this. And we are looking at a variety of approaches for supporting public transportation right now. A lot of that conversation's over in the legislative branch, but the executive branch is part of this story as well. And usually, as you all know, our program is usually about capital funding primarily. It's about buses, minivans, facilities. And that's especially true for the areas over 200,000. The providers in small urban places, they do receive you all receive about 30% of your operating funding from FTA. That's the average. And what's happened with the COVID public health emergency is we flipped from, providing mostly a capital program, even 70% capital in small urban places, to what's really, all of the money is being used overwhelmingly for operations. And, that is making tremendous sense, right? That's what it should be given the circumstances. And so, from the National Transit Database, our staff was able to look at that, and we can sort of forecast, how long different transit providers might be able to fund their operations at, say, pre-COVID operating levels if you just have the CARES Act funding to go on. But we know there's a lot more to the story than that. And so our people who've been working mostly remotely, who've had great focus on the CARES Act funding to you, we've been working to deliver that $25 billion. And to date, we've awarded over 600 grants. We've awarded 90%, almost 90% of the CARES Act funds through grant awards totaling $21.7 billion. And that's going to states and communities all over the country. There's another 187 grants that are in process right now. That's another $1.6 billion. And there's about 34% of all the CARES Act funds that's already been paid out, right? So $8.6 billion has already left the US Treasury. And we know that ours is a lagging program, right? We run a reimbursable program. So by the time you come to us for the money, you've already spent it. So we know that people are effectively using the CARES Act dollars to serve your communities. We're also keenly aware, of this challenging decision that many of you are facing right now, delivering service, planning for the future, and we're trying to make your work more easy, not more difficult. That's really one of our goals at FTA. And so our people have really taken great pride in quickly making the funds available and providing as much relief as we can. Since last winter, or since late winter really, Jane Williams, our acting administrator, has been holding regular bi-weekly meetings with industry leadership. And so we get together with Scott, we get together with his fellow CEOs from Keynote and Apta, and we really just compare notes. We talk about what's occurring around the country. We're trying to identify solutions to the emerging problems that we see ahead. It's one of the ways that we've been able to collect information and rapidly publish answers to the, I think, over 1,100 questions that we've received so far, and we've posted those answers online. And so during the industry calls, we regularly discuss, how to safely expand service and how complicated that can be, but how we can do it well. And we've taken measures to support you by distributing personal protective equipment, PPE. Enrique and her team, they work closely with FEMA and other federal agencies to prioritize public transportation to receive PPE. And the result was the more than 14 million protective face coverings that have gone to the transit industry. We're really glad we were able to crack that nut and provide some of those resources. Many of you have shared stories about how those face coverings have been valuable in your efforts to support economic activity, and we couldn't be more pleased to help prioritize that, both for your employees and your passengers. On Tuesday, you're going to hear Jane Williams talk about how CTAA, working with Apta and FTA, we're working to provide an online COVID-19 recovery vendor list for public transportation. That's live now. It's got links, I think, to over 200 vendors who are offering products related to COVID-19 recovery. So we think that's going to be an important success, and we look forward to your feedback about it. Even as we're providing the CARES Act funding, we are continuing to advance the rest of our programs under the current circumstances. We've been making a lot of formula grant awards. We're advancing project planning. We're doing NEPA work. Our FTA-funded bus testing center is operating again. The FTA-funded technical assistance centers, RTAP, the Mobility Management Center, the National Center for Applied Transit Technology, that's a new center that CTA initiated this year, they're all there for you. And also the National Transit Institute is providing more content each day substantively online. So as part of our continued funding of programs, we're on the cusp of announcing selections for a number of competitive grant programs. This includes the $1 billion DOT build selections. Those should come out in September. We also have our $11 million Accelerating Innovative Mobility, or AIM program. Those selections should come out soon as well. And then there's the $454 million buses and bus facilities selections, which by law, for all these competitive programs, we provide Congress with 3 business day advance notification before we do any news releases. And when we do that, you start seeing the news releases come out. So I'll just tell you that that's imminent from FTA. Even as we've been maintaining our existing funding and technical assistance, I hope you've seen we've tried to reduce your regulatory burden. Enrique, Bruce, the regional administrators, their colleagues, they really acted promptly to postpone the Public Transportation Agency Safety Plan implementation deadline that applies to some of your agencies. We postponed our oversight reviews. We tried to create space, really, so that you could focus on very high priorities, keeping your people safe, keeping your passengers safe, delivering service that people need right now. And so, we recognize this is a moment of some great uncertainty. It's also a moment of change. And what we also know, though, is that people are going to continue to share rides, right? That are available to everybody in the community. That's public transportation. And we're going to figure out how we're going to do that. We're going to figure out exactly what the future of transit is going to look like. But we're going to have to need those people sharing rides, that public transportation, for our economy, to give people access to medical care, to accomplish all the things that we know better than anybody transit can accomplish. So through the end of the year, we're going to be hosting a series of listening sessions each month to facilitate peer-to-peer exchange. I know CTA is doing similar outreach. It's really important when we can't meet face-to-face that we're having some of these virtual conversations. The sessions that FTA is going to do are going to feature a panel of professionals each month. Our August topic is going to be maintaining healthy operations and keeping transit workers safe. Our September session is going to be on managing vehicles and facilities in a new service environment. And you can visit the FTA website for those listening session details. So please do that. And then, I'll just tell you that at FTA, we continue to be focused. We have a 6-word mission statement: improve public transportation for America's communities. Simple to remember. And, I always tell our folks, we don't own any buses or vans at FTA. You do. We don't operate any assembly lines. We don't have any construction equipment. But we accomplish our mission in partnership with all of you. And right now, that's really important for delivering safe, reliable transit. So I want to thank Scott and CTA and all of you for that continued partnership. And then obviously the most valuable part of this conversation is not me talking to you, it's us having some conversation. So with that, Enrique, Bruce, and I are interested to hear what's on your mind and see what answers we can offer. Thanks, Scott.
Thanks, Matt. And for everybody, I posted a link to that vendor list in the chat box. We were really happy to work on that. As we want to do our part in trying to connect all of our members with the best possible products, services, and PPE. And one of those things that came up yesterday that I wanted to kind of start off the discussion was the important role you guys played in getting all those masks out. So many of the operators here are talking to us about their concerns when they're operating in a state where perhaps a governor hasn't said you must wear a mask on transit, and how suddenly then a transit driver operator is in that enforcement mechanism, and how important it is to be able to say to a passenger attempting to board without a mask, instead of, no, here's a mask. Just put this on while you're riding, it's safer for everyone. The question was, how long do we think those distributions are going to continue, knowing that none of us have a crystal ball and know when the end game is on any of this?
Yeah, so Scott, we've worked towards that, and I'm going to turn to Enrique because she's been working on the protective equipment question.
So I would just say, we recognize that, you know, this may be more of a prolonged effort than any of us anticipated when we first got into this to this. So one of the things that we're doing at FTA is just continuing to monitor the needs that are out there. So we will continue to keep the list. You know, it's important for us to hear from you if there are shortages or if there are needs that are out there. We are continuing to keep an inventory of that so that we can continue to have that dialogue on a national level where it's needed. We anticipate that the masks that we've sent out will last a couple of months, but as more and more time goes on, what's important is for us to understand the needs. And so if the members continue to work with their regional offices, we're continuing to get 3 times a week reports from our regions. So where an agency has said that there's a shortage or there's a need that they have, we're collecting that information and trying to work within the system to make sure that we can help address those needs.
So everybody listening, there's the way you let us know, but most importantly, let your regions know what you need, and that information is getting where it needs to go. So as I know that came up in a couple of sessions yesterday, that's the quickest and directest line in these communications. Another thing that came up yesterday that I wanted to ask about is we're starting to, you know, this group of members in CTAA often kind of feel like they're not the big guys. They're not the little ones in the rurals. They're the overlooked in the middle group. And so is there a way that at FTA, from a leadership perspective, you'd like to see us communicating hey, when they're going to run out of their current CARES Act allocations, or indicators of stress and where things are reaching a critical juncture in terms of being able to continue to provide essential services? How best does, and you know, CTA wants to be the lead on this, and in our conversations every other week are places that I can certainly share that, but what kind of information best suits your decision making right now and helps inform you best?
Scott, there's a few different ways that we acquire information, especially right now when we want to be attentive to the circumstances of our grantees. And we know, as I mentioned earlier, roughly how the CARES Act funding could cover operating expenses for different areas, right? But it's not precise. So our regional administrators, they have regular conversations with all of you, and they and their staff, they compile that information and they bring that to Bruce about what the funding looks like. So that's one line of intelligence that we get from the grantees to the regions. And then I think CTAA and the industry associations really play a critical role in this process. You all, you're more limber when it comes to doing surveys. For us to do a survey of our grantees has a number of complicating steps, even under these circumstances. And so when you go out and you talk to your members and you collect information and you share that with us during our regular industry executive conversations, that's really valuable too. So I would ask your members to stay in touch with CTA. When you do your surveys, you're able to do rapid information collection. So there's a few different ways we're monitoring the circumstances. Obviously, you know, you all are organized and you speak to the executive branch, you speak to the legislative branch, and we hear you when you speak, when you share letters. So there's a number of different streams of information, both sort of data-driven as well as conversational, that we've relied upon to monitor those circumstances. And we also look at the grant information. Yeah, Bruce, go ahead.
Yeah, I was going to add, we do look at the grant information. Particularly, we're focused on the rate of expenditures or disbursements. So, you know, in terms of obligations, we're close to 90%. The rate of disbursements is about 33% or a third of the funds. But when we're looking at that, we're asked questions from Hill staff and others. You know, what are the differences between rural areas, small urban areas, and large areas in terms of, you know, their annual operating expenditures and their rate of disbursement? And you know, in general, for you know, the rural areas, they may have been provided you some of them up to 3 years worth of funding. It may be closer to 150% for most. And small urban areas, it may be on average about a year's worth of funding. And then the large urban about a half year's worth of funding. But we've also tried to point out that there's wide variability within those groups. And there are rural areas who have dispersed all their funds, and there are small urban areas who have dispersed all their funds. Because the way the funding doesn't go, the funding as a portion is not directly tied to operating expenses. There's a number of other variables in terms of population and other factors that go into the actual apportionments. So we've been sure to share that information, but to the extent that you have information that identifies recipients in areas where there's need, sharing that is helpful, because at times when you look at the big picture, it gets buried within the averages.
Yeah, that's a good point, Bruce, and that's what we've tried. We always do try not to be Chicken Little and run around like saying the sky is falling, but at the same time, I know certain members, we've worked with them for years, and when they start to say they're reaching those issues, they wouldn't say it lightly, and it's been good to be able to share that. Two obvious questions that have been raised. One is the one that Kim raises from Corvallis, Oregon, and it's just the notion that as ridership returns, and like we had a university transit session yesterday where some of our members here are serving universities that have said we are opening in a normal capacity. And when you're facing that, but you're trying to maintain social distancing, those lines cross at some point and become really problematic because you just don't have enough vehicles to shadow those kinds of routes. Is there any absent absolute guidance on this, which I don't think it's such a gray area, but how would you advise systems that are starting to see that as an issue manage it, because it is their operational reality right now?
Yeah. Enrique, you and your team have been talking about that with some other agencies. So I'll turn it over to you.
Right. I think we see with the aviation industry and some of the practices that we see in Europe, is when some of the social distance becomes impractical, it becomes more important to make sure that you're doing some of the other mitigation measures, such as the face coverings. So you're right. There gets to be a point from a service level standpoint where we may not be able to do all of the mitigations that are outlined, and yet we need to figure out what's the balance that allows us to keep our industry, our passengers, and our operators safe. And so we have seen agencies that may not be doing 6 feet, they may be doing 3 feet, but it's how do you create some separation? They may be doing the barriers between the drivers and the passengers. They're handing out the face covering. So it's not a one-size-fits-all approach. It's collectively, how do you deploy the tools and the methods that are out there in the best way to help you keep your customers safe?
And that's what they're doing, and they're kind of asking through us, like, it's my only option. And these, as Matt mentioned, we've really learned just how essential these operations are in the last 4 months. If nothing else, it's revealed to us what just seemed like a word before. Yes, transit is essential. Well, we've seen that play out in reality now, and I think that's helpful to hear, because it's something that all the folks on the line here at some point in time are going to face.
Right, and it's localized, right? So in one area they may still be able to do 6 feet and provide extra buses, and it's working for them. But in another area, ridership may be recovering at a level that becomes more difficult. And it's how do you use the disinfect, all the tools that are out there in the best way possible to be able to provide the service that your community needs.
Yeah, and that's everybody's objective.
Yeah.
no doubt. And again, would all be impossible without the CARES Act funds. I mean, that's been a case. About the CARES Act funds, about the amount that's been obligated, we're reacting to what we're hearing rumor-wise, that the administration may be seeking to pull back money that hasn't been obligated to help offset a CARES Act 2.0. If that's too political, I understand, but it's something that has been raised in several forums here. And is that something that our folks on the line need to react to, or is that more conjecture coming out of DC and not reality?
Yeah. Scott, what I'd say is, I noted earlier that we have almost 90% of the transit CARES Act funds obligated. More than 3 out of $4 has already gone out the door, right? And we know that, again, we run a reimbursable program, and we educate people about that. So I think the transit folks have done a smart job of obligating the funds, demonstrating the need. We also recognize, as Bruce was describing, that different operators will utilize those funds at somewhat different rates. I think that's something that CTA can articulate, but I think we on the transit side are using those resources effectively right now, and I expect people will notice that.
It's been great every other week to hear that number ticking up and up and up, because we know what that means. And there's just, it's hard to react to rumors. And
it also, yeah.
No, go ahead.
It also goes back to the point you were asking earlier about how do we distinguish among rural operators and small urban operators and larger urban operators. And the way the CARES Act funds will be used is going to vary somewhat based on some of the operator characteristics. And we've been articulate, and you've been articulate about those distinctions. So I think when people understand that, they know how we're using the dollars effectively.
It reminds me, Matt, of when we were having discussions during the government shutdown, and the rural and the smaller agencies were really at risk, and the bigger agencies and it's almost like that world has gone opposite in terms of the risks in this. It's hard not to remember that, and it seems striking that way.
Yeah, both times, right? So when we had the federal government shutdown, it was our grantees who are somewhat more reliant on the federal government for operating funds that were at risk, right? Yeah. And now with the current circumstances, when fare box revenue has dropped off from those large operators who typically receive more money from fare box revenue, they're in a pinch. So operating revenue streams are often the driving factor, at least in these two cases we're talking about.
Yeah. Well, and a big focus of our session this morning was on what's coming next in terms of supplemental appropriations. And I know I've been kind of a broken record in our calls every other week, but we believe strongly, in the people that are the participants here actively and strongly, that the formula programs are the way to go with any additional funds. That we've got a pipeline that we know works. It's already set up. Fairness is built into it. And it's not really a question, but just kind of a statement that I want to make sure I emphasize, because that was loud and clear communicated in an earlier session we had on that this group of operators and CTAA are really in line pushing that at the legislative side right now, because we're really concerned about different ways of doing that and getting left out. Yeah.
Yeah, we know that Congress is looking at a few different scenarios, right? And we also know, as you're highlighting, Scott, that the reason we've been successful working together, moving the CARES Act funding forward, is because of the formula nature. Those are programs we know. They're programs our grantees know, and we all knew how to manage them effectively. We posted a lot of FAQs with whatever modifications were warranted. There are circumstances where Congress has identified tweak to the way funding is distributed based on some distinct characteristic of a grantee or grantees. So we realize that's something they're trying to balance in the balance right now. But I think, yeah, we do have in the rear view mirror a history of formula grant programs being used effectively. I don't know if Bruce or Enrique have thoughts on that as well.
Yeah, and just in general on the formulas programs, we do need to take into account, or you need to consider, we have, prior year formula funds that are still available. We have the FY20 appropriation. I would, looking at the trends, I think we'll probably obligate less of our formula funds than we normally do on an annual basis, largely because recipients have been focused on the CARES funding, and then we'll have a FY21 appropriations. And for small urban areas, you can use those funds for operating expenses, but at a 50% match. So I think if there are issues when you're thinking about the needs, if there's issues that are to prevent small urban areas from accessing the existing formula funds that they have as well. So in addition to thinking about supplemental funds, but the funds that you would have, that would also be helpful to identify. Are these areas going to have difficulty, identifying the 50% local match to the existing funds that they would normally be able to obligate, set aside from any additional supplemental funds that could be provided? That's not necessarily data that we have, but if you have that type of information, that helps fill in the big picture in terms of, because I think that's what the administration that Congress will be looking at is what are the funds that are available to transit agencies over the next several years, and if they see large amounts of available, balances that haven't been obligated in grants or haven't been dispersed, those types of issues would pose questions. So getting ahead of that would be helpful.
Do you one of the questions that's come in, which speaks to, we've all looked at the approps bill that passed the House last week, and we see FY21 seeming to be moving along the track of it also being up to 100% federal. I'm asking you, in your crystal balls, are you guys are prepared to deal with another year or two at that rates, and that's something that because we think it's very likely, and many of the systems are going to need it.
Yeah, we recognize that Congress may make some statutory changes to how our programs are administered in terms of additional statutory flexibility. I know people have talked about how the NTD numbers are managed for formula funds, availability for operating versus capital, what the federal matching share is. Those are all on the table right now.
Yeah.
Enrique, you could talk about some of the flexibilities we've provided to date in that space.
Yeah, I think what I would say is, so as we've talked about before, Scott, right now we're really focused around 4 areas. We want to make sure that we're providing proactive technical assistance and best practices and peer exchange and lessons learned for the industry. From a funding standpoint, we want to make sure that we continue to get the funding out. And so if Congress gives us a new allocation, if it's at 100%, our systems are set up to deal with that. So we were able to get the CARES Act money allocated in 6 days and out to the transit systems across America. And we will be prepared with the next slosh of funding, if it comes, to work as hard and as expeditiously as we can to get the money out to the industry. We also want to make sure that we continue to provide support like the PPE support, the vendor list, what the needs are out there, the best practices in disinfecting. We want to make sure that we identify that for the industry so that the things that we need to do to make sure that we're operating clean service and a service that is less risk for our passengers and our operators, that we're investing in the industry being able to do that. And then the last thing is continue to do administrative relief. So we've postponed the triennial reviews because we wanted to make sure that the transit agencies were able to be flexible and able to focus on the emergency at hand. And I know I saw one of the questions where someone said, how do we deal with the procurements? How do we, you know, we had different rules for some of the emergency relief programs. Well, that's one of the things that we're also looking at right now. As Scott pointed out earlier, we've done the economic recovery, we've done Hurricane Sandy recovery. So we have a body of work before us that this is not the first time that we've had to have competing oversight requirements based on the color of the money. And so one of the things that we have said is for emergency response, some of the procurement rules were not applicable. Some of your contracts that weren't federalized before, you were able to use your money for. And we will make sure that as we go through the oversight process, that the rules associated with those resources are clear. And so one of the things that we're working on now is what an oversight program might look like for the next round, and also making sure that we are clearly delineate the flexibilities that have been allowed as a part of the COVID recovery, so that you won't be deemed for those things as a part of your traditional oversight as we start to move forward. So.
That's great to hear that you guys are incorporating the reality into the process. I think that's all we can ask for, is that. And the last question, you see the one that just came in, you know, are you guys working on any interim policy for state DOT oversight of subrecipients? Kind of more leaning towards our rural members, but the state DOTs are all members of CTA, and some of them are participating. Has there been any thought along those lines?
So we're not particularly working on interim policy for state DOTs. What we are working on is what our oversight program would look like as it relates to oversight of the states and their subrecipients. And so some of the federal requirements, states may have requirements that are outside of the federal requirements, and they would need to be looking on a local level in terms of how they deal with some of the flexibility needed in that realm. What we are working on is making sure that we lay out a program that recognizes the flexibilities and the administrative relief that we have laid out as it relates to COVID-19, and that we clearly identify what those flexibilities are, and that we provide the technical assistance that allows the states to be able to understand the flexibility. So if you have a contract that didn't have all the federal clauses, you needed to mobilize it for your emergency response. We want to make sure that it's clear that we don't come back and ask you now for that contract to have federal clauses. So we are crafting how we incorporate the CARES Act flexibility into our oversight moving forward. We're also crafting what that oversight might look like moving forward, because just like we're having a virtual conference here, we all recognize that we're still in a posture where people aren't traveling, particularly for non-mandatory type business related expenses. So, you know, we have more to say. We will have more to say on this in the future, but we are looking at what the future of our oversight program, particularly in fiscal year 21, would look like.
I mean, it's your approach there is consistent with the way you've approached all of the other regulatory relief that you've brought forward. And I think it's always refreshing to know that no matter what the topic, you guys have, you got an answer for it, or you're working on it. And that's, you know, that's what we all want to hear. So with that, I just would like to thank the three of you for giving us so much of your time today. It's really a pleasure to work with you, and as we can see, it's a time right now where the cooperation and the collaboration has never been more important. And CTA, we're committed to trying to get any information you guys need to do the important work you're doing, and the timeliness of your work in all of these facets is much appreciated, and we're all grateful for it. So thanks for your time. I'll probably be on a call with you shortly, but in the meantime, enjoy the rest of what looks like to be a relatively nice Friday afternoon here, and we'll see you soon.
Bye, everybody.
Thank you very much, Scott. Thank you.
Thanks to everyone for participating. We've got, as you see, a link in there just to a brief concluding session, and we're looking forward to seeing you all there, and appreciate your time today.